خائف من زيكا.
The faces of despair on relatives of cholera victims.
MERS outbreak explodes.
More than 75 million people in WHO's Eastern Mediterranean region live in countries experiencing complex humanitarian emergencies. Emergencies increase the risk of disease outbreaks that threaten national, regional and global health security. The region experiences outbreaks of cholera, dengue fever, yellow fever, extensively drug-resistant typhoid fever, Rift Valley fever, Crimean Congo hemorrhagic fever and chikungunya. And the list is growing. In 2003, an outbreak of avian influenza was detected in 17 countries and resulted in 861 human infections and 455 reported deaths. Middle East respiratory syndrome, first identified in Saudi Arabia in 2012, also spread to 27 countries, infecting 2,400 people and killing a third of those infected. Countries need to work together to prevent and control the spread of dangerous pathogens. The Pandemic Influenza Preparedness (PIP) framework brings together WHO, member states, industry and other stakeholders to implement a global approach to preparedness and response. Its key goals are to improve and strengthen the sharing of influenza viruses with human pandemic potential and to increase access to vaccines and other pandemic-related supplies for developing countries. Since the 2006 outbreak of avian influenza in Egypt, 19 countries have established functional influenza surveillance systems and 18 share influenza-related data with WHO through mFlu. Virological influenza surveillance capacity has also improved significantly in the last decade. 19 national influenza centres and other influenza laboratories have now developed capacities to detect seasonal, zoonotic and pandemic influenza viruses. The number of influenza-positive specimens being shared with WHO collaborating centres has increased from 142 shipments in 2011 to 1,473 shipments in 2019. More countries are also estimating the influenza burden and can calculate their influenza threshold values with findings being published in peer-reviewed journals, including the Eastern Mediterranean Health Journal. Capacity building and field visits are taking place in the areas of outbreak investigation and response, detection, infection control measures in hospitals, risk communication and the training of rapid response teams. Risk communication materials are being produced to engage local communities and raise their awareness about infectious diseases, while emergency risk communication action plans are being drafted at the national level to help prepare the relevant authorities for the next influenza pandemic or disease outbreak. The WHO Regional Office continues to support these activities through the Eastern Mediterranean Acute Respiratory Infection Surveillance (EMARIS) network. The EMARIS network meeting aims to review achievements and shortcomings of surveillance and response systems and discusses how to strengthen these through the sharing of evidence and best practice. It also invites researchers to present their operational research findings and trains them through skill-building workshops. Let's work together, keep people safe, and protect our region from the threat of emerging and pandemic diseases.
Welcome to the second scientific conference of the EMARIS network, organized by the World Health Organization's Regional Office for the Eastern Mediterranean. We wish you a successful event.